Hello, everyone. I hope everybody can hear me fine. Thank you for joining us. Today, we have the absolute pleasure and honor of having Moshe Heller here with us. He's a graduate of Pacific College of Oriental Medicine in San Diego, California, and he is the former academic dean at Pacific College, New York, and former chair of the Department of Oriental Medicine. Moshe has been practicing and teaching traditional Chinese medicine since 1994. He taught at the Hebrew University, in the Medicine College, at the Israeli College of Complementary Medicine, and at Pacific College in New York City. Moshe's postgraduate work was performed at the Guananmen Hospital in Beijing, China, where he focused on internal medicine and TCM gynecology. He has also taken various postgraduate studies, including pediatrics and Japanese acupuncture, participating in the Lutheran Medical Center research study that was focusing on the use of acupuncture during labor and delivery. Moshe has served as a board member of the Acupuncture Society of New York and currently runs a busy practice in New York City. Moshe, thank you so much for being here with us tonight. I'm going to give you the stage now, and thank you again for accepting this Global Branches invitation.
Okay. I'm going to share my screen. I think maybe you need to, for some reason, it's not letting, oh, here it is, sorry, yes it is.
I would like just to make a quick reminder that this webinar is also an introduction to Moshe's course that he will be doing with Global Branches in a few weeks about pediatrics and the first cycle of life. And also that if you wish to make any questions during the presentation, be sure to make so either through the chat or eventually raising your hands. Don't be afraid also to interrupt Moshe for any questions. Thank you.
Yes, thank you very much. Thank you. I'd like to really thank Global Branches for organizing this webinar. It's a pleasure. Oops, sorry. As you've heard, I've been really practicing and teaching Chinese medicine for almost 30 years, and allergies that's what we're going to be talking about today, is a condition that I've been seeing more and more in my office. So I think it's a growing concern. And hopefully what we go over today will help you really treat children in who are suffering from allergies. And I want you to know that actually Chinese medicine has amazing tools, really very helpful for helping patients either eliminating or moderating their allergic reactions. So definitely we can either help or completely eliminate the condition. So I hope I can give you some good ideas on how to help your patients with allergies. And so here we go on our journey. I think that I'd like to just point out that I'm going to try to fit everything in this kind of 1 hour lecture, and a lot of it will be kind of referring to things that I'm going to be talking on later on in the course that I'm giving with Global Branches on the first cycle of life, meaning that how to treat usually children between from birth to about 7 or 8 years of age, which is the first cycle of life. So as you can see in this, and by the way, as was mentioned, I am going to provide these slides to you, so just that you know that it's going to be available through global branches. So as you can see, in the slide, there's a really increase of cases of allergy. It's becoming really an epidemic, that's happening both all over the world, not only in the U.S. You can see here the rise in U.S. Food allergies. The numbers are growing, and in Europe, it's one of the most prevalent chronic diseases currently in Europe. So the numbers are really growing, and it's important to have tools to address the issues that come up with allergies. And I wanted to actually start by talking about a case study, because I think that through this case study, we can demonstrate a lot of concepts and ideas. And I chose a case study that was relatively, easy, and so that, but still pointing out to very important concepts of diagnosis and treatment that we can discuss. So, but it will give us the framework to work with these ideas. So this is I want to talk about a patient that I had. He's a 9-year-old boy, and the main complaint, he was suffering from allergies, and we're talking about seasonal allergies. You'll see that in a second, for the past 5 years. So he's 9. So it started around when he was 4 or 3 or 4, which is also a very critical age. We are going to talk a lot about this kind of age group between 2 and 4 in our course, which is a very hot phase, and a lot of heat can manifest and then linger and cause diseases later on in life. So as you can see, the chief complaint was nasal congestion and sneezing and watery, itchy eyes. And so as the interesting thing is that although with allergies, and you see that a lot, the main symptoms seem to be cold, nasal congestion, white mucus, watery eyes. A lot of times there's a mixture of cold and heat, and we'll see that later. Occasionally, he will experience some lung congestion and cough, so the phlegm is lodged in the lung, and it runs between being clear and yellow sputum. So there's a mixture again of cold and heat, and there's some stagnation because the phlegm is really difficult for him to expectorate or bring up. The patient's mother says that he's more susceptible to catching cold. So we see that there's a propensity to get pathogenic influences, cold, flus, and things like that. And she compares it to his brother. His brother, he has an older brother which does not have all this, doesn't get sick as quickly. So, and compared to his friends, she feels he gets colds more frequently and more easily than others. That shows that his Wei Qi is not strong, and he gets reintroduced to pathogenic influences. She also reports that she did some allergy testing. And allergy testing is a whole subject that we can discuss for a long time, but the issue is that there's different kinds. One of them is doing, it's called the skin test, where they actually introduce subcutaneously the different substances and see the reaction. That is the most common way of checking traditionally for allergies. And I really don't think it's very reliable. And therefore, I usually recommend to do a blood test. Now, a blood test is also tricky because blood tests traditionally, when you check for allergies if you go to an allergist and he'll send you to a blood test, they will check IgEs, which actually checks mostly for allergic responses. And we'll see later there are different types of allergies. We'll talk about that in a little bit. And one, more commonly are sensitivities and intolerances are manifest in the IgGs and IgAs rather than the IgEs. And but in the mainstream Western doctrine in the US, I'm not sure how it is in Europe, but definitely in the US, a doctor will only check IgEs, and in fact, the insurances won't cover any IgG testing, so it's all private that does that. But on the other hand, there's a growing number of labs that will do IgG testing and will give you a more broad and accurate, I think, picture of the allergic response of that particular patient. So as you can see here, the testing here in this case was skin sensitivity. So as I said, I only took it in a grain of salt. I don't think it's extremely accurate. But definitely there is some kind of an allergic reaction. We can see that, generally speaking, these group of patients are called atopic tendencies, or so we can see these allergic tendencies by all the symptoms we described. He also had another issue that the mother was complaining is that it was a struggle to get him to sleep. So falling asleep was a big issue. And so he would actually go to sleep really late. And then he would have to wake up early for school. So that averaged about 6 hours per night. And I thought that was really a problem. It interferes with the ability to produce chi in a normal manner. And a lot of times you see that when patients don't sleep enough, their tendency to become inflamed is higher. So definitely something that I took into consideration, that there's only 6 hours of sleep. He also suffers from clear nasal congestion. So when it's not runny, it's all congested and hard for him to breathe through the nose. He has a headache when he's tired. So so it's affecting the flow of qi to the head. And then he tends to experience cold sore 1 to 2 times per year, meaning that we see some underlying heat in the spleen. Of course, it comes on the lips. The lips represent the spleen from my perspective. So there's some heat coming up, and we can definitely see that. He's very, very sensitive to smell. So the smell of food can cause him to have a gag reflex, and then he's averse to various things in terms of eating them because of their smell. So it has hypersensitivity to smell, and that's also very typical in patients with atopic tendencies or allergic tendencies. And on top of that, he also had this rash eczema behind both knees and elbows. And so this eczema is part of the atopic picture, very commonly mixed together. So when I was actually surprised that a lot of times I get patients that come in for the eczema, and then I see all the other symptoms. In this case, it was the opposite. The allergies was what brought them in. And then they say, oh, by the way, there's eczema. And the mother sort of brushed it away and said, oh, I just put some cortisone cream every now and then it disappears and then it comes back. So from I really believe that putting cortisone cream on eczema is definitely not the way to go. So, and it could be related to the kind of suppression of an inability to come out of the allergic cycle. So definitely we discussed about changing instead of using cortisone, we talked about different alternative creams that can calm everything down, but yet not don't have cortisone. So he also had this chest tightness. So this phlegm was lodged in the lungs, and it created shortness of breath. If he did a lot of exercise, that would become worse. And also when he was exposed to cold, so cold made the chest tightness worse, which makes sense, of course. So we see this kind of combined stagnation, deficiency, and phlegm in this patient. So his tongue was pale and puffy, and so that indicated that there's definitely some sort of like this kind of qi and spleen and lung qi deficiency, a slight center crack and a red tip, manifesting this kind of heat that's coming up to the head, and a slightly thick and white coat on the tongue, which indicated the phlegm, of course. The pulse was slippery. When I take pulses in a 9-year-old, I don't weigh so much weight on the diagnosis of as part of the diagnosis, but I do take it to sort of feel what's going on. The slipperiness in the tsun, especially on the right tsun, was definitely indicative of this kind of phlegm congestion in the lung. And I found a very other interesting finding, which was inflamed lymph glands submandibular and on the sides of both sides of his neck. So this lymph gland enlargement and congestion is something I check regularly with children because it's an indication. It points towards a lingering pathogenic factor. Lingering pathogenic factor is a diagnosis I do is I think very common in children, more so than we would like to believe, where there was an original disease pathology. Usually a pathogen has invaded, and the body wasn't able to completely resolve the pathogen, and it lingers. It lingers for, it can linger for a long time. I think in his case, it's definitely at somewhere towards when he was 4 or 5. That's when his original invasion was. So this lymph gland enlargement is really important diagnostic tool. Of course, I will not base all my diagnosis. So definitely, if the lymph glands are swollen, it doesn't mean that there is necessarily lingering pathogenic factor, but it points towards that, and we have to find other symptoms that kind of corroborate that diagnosis to make sure that that is the right that's what's going on. And I think that was what was going on in his case. And Another thing that I did that was very interesting in this patient, although he was 9, I could clearly check his finger vein, and it was present and very dark. So what do I mean by finger vein? I'm not sure if you're familiar, but we're definitely going to be talking about that in the course, because it's a diagnostic process that is usually recommended to do in children 0 to 2, or from birth to 2 or 3, and then it becomes generally less applicable, and usually the vein disappears at that stage. But it's a vein on the index finger, on the large intestine side of the finger, and you would rub the finger to look at it. You look at the color, you look at how long it is, and these are all diagnostic diagnostic techniques to find out how strong the pathogen is, at what level, and how dangerous it is. But at a 9-year-old, this is not a very strong diagnostic factor. But the fact that there was the vein was still present, and we could see it, and it was very dark, told me that he has some kind of a deep, hot pathogen that's still present in his body. I say heat because in the finger vein diagnosis, the color of the finger vein is very important. If it's dark, it refers to heat. If it's pale red, it refers to cold. And if it is purplish, it refers to stagnation. So we could definitely see this presence of a very dark vein. I also looked, it's another thing you commonly look at this a diagnostic process in children. It would look at the cheeks, and the mother reported, I saw that there was a little redness around the cheeks, and you will see, I have a picture that comes in the next slide. You'll see him. In the slide, it's not as obvious, but the mother reported that his cheeks are frequently really red, almost like a rash, but not really. And it's there most of the time, winter and summer, and just all the time there's a little bit of redness in his cheek. And also that there are dark circle under the eyes and a puffiness. And what I actually noticed is that he had a little sparkle in his eye, and I'm going to show you the slide. This is a picture of the child. You could see the puffiness in the eye. You could see the dark area here. The red is not so clear, but it was all around here, and it wasn't as red as usual in the picture that this one. Anyway, the sparkle, you see, almost it looks like his eye is wet. And I'm not sure how familiar you are, if some of you have children and you've seen them growing up, and you see that when they have fever, they usually have that sparkle. A lot of times you know a child has fever by the look in the eyes, this kind of sparkle. It almost looks like it's wet or about to cry. And you can see that in this kid. And actually, this is a really strong, another sign for a lingering pathogenic factor. So when you combine this look together with the enlarged lymph glands and the story of this reoccurring cold symptoms, this is a strong indicator for a lingering pathogenic factor. So in fact, I thought that the reason this child was experiencing the allergies was part of his lingering pathogenic factor symptoms. So in fact, what I decided, what I diagnosed this child with, was a lingering pathogenic factor with phlegm accumulation. and underlying lung Qi vacuity. So that this was his diagnosis. I used acupuncture points like large intestine 11 and 10, lung 7 to regulate the lung Qi. Gallbladder 40 is a very important point as far as I use it a lot for allergic rhinitis. It's one of my first points that I think of when I think of clearing the sinuses. Because it has a really strong effect on the sinuses. And in this case, a lot of times I use it with moxa. I use spleen 9 to help drain dampness from and help the spleen drain dampness and transform phlegm. And I use liver 5 because I think that liver 5 helps with transforming phlegm or helping the liver move through phlegm, since liver 5 is traditionally considered the master point of plum pit. Plum pit, again, is this kind of accumulation of phlegm in the throat due to combined with liver Qi stagnation. And when you use liver 5, it helps the liver move through phlegm, transform the phlegm, and resolve it. I also sent this child home with magnets. I used the combination. It's actually, this combination comes from Julian Scott for lingering pathogenic factor, and it's the extra on the back by Lau, UB 13 and 20. By Lau I used with dispersion method with the magnets, and 13 and 20 with tonification. I also used a special point or extra point from Kiko Matsumoto. I hope you're familiar with her. She's a prolific writer and does a lot of seminars on Japanese acupuncture. But she used this point that is called behind stomach 44 or below stomach 44. It is a point on the sole of the foot, right behind where stomach 44 is, on the side of the sole of the foot. And I left a magnet and dispersion function over there. She uses this point as a sort of like a point for allergy. So any allergy anywhere where it's manifesting in the skin or in the mucous membranes or any, if you believe that there is an allergic response, this is a magic point below stomach 44. Then I recommended to avoid dairy and wheat, and the reason I recommended to avoid these two is because these are really great phlegm or damp producers. So we wanted to help the body resolve phlegm, and by eliminating dairy and wheat, we're eliminating some of the diet. I also discussed a lot with what to eat and what vegetables to eat. For example, having some white root vegetables like parsnips and rutabagas are really good to help the lung resolve phlegm. So we talked about that, but I also asked her to avoid soy and nuts in order to not stimulate the immune response. And I believe that once we clear the heat, resolve the phlegm, clear the lingering pathogenic factor, it is actually, he will be able to be exposed to soy nuts with no reactions later on. So I also recommended that they sleep at least 7 hours a night, hopefully more, but not less than 7. And that was really something I stressed when I treated him. I gave him a herbal formula, which he took. It was a combination of Xiao Chai Hutan, which is my favorite formula for treating lingering pathogenic factors. And I combined it with Wu Mei Wan, which we'll talk right after this and explain why, or one of the reasons why I chose Wu Mei Wan as this as a reason for this patient. So he took this combination, and I'll give you the herb breakdown in a second. And then I continued this formula and regular acupuncture treatments once a week for 6 treatments. And at that time, the patient reported that he felt much less congested, and the attacks of sneezing and runny nose were much reduced. The skin rash was almost completely gone, and so he reported an improvement. Although there was an improvement, I continued the treatment for another 6 treatments, but every 2 weeks. And after that, after we completed these sessions, his skin completely cleared, and he reported that there were no more, the nose was open and relaxed. He was able to fall asleep more easily. So he had many improvements. And at that time, I wanted him to continue a little bit with a combination of jade windscreen, which we'll see in a second again, for continued treatment and support of the Wei Qi, so there's no reinfection. And this child is already, I saw him 2 weeks ago, and he's doing much better just for a checkup, and he's almost doesn't have any allergic responses. So the formula, the variation of Jiajian Wumei Wan that I used, so it was here at the beginning, you see the herbs Wumei, Chuanjiao, and Huanglian and Huangbai. So it's quite a bitter formula. This is the classical formula all the way up to here. And then I added some herbs that help to, first of all, antiparasitic herbs, added more of those like Binglang, as well as Yujin and Beishashen. And then I added some spleen strengthening and resolving of phlegm, Shichangpu, one of them. And then this is the classical Xiao Chai Hutang. I didn't modify that at all, but this combination is what he was taking. After he was feeling much better, I moved to jade windscreen, and this is the formula that he gave him. I added some Jininhua and Juhua to sort of help in resolving, so preventing, supporting the prevention of any pathogens invading. So the next slide, I want to talk a little bit about why I chose Wumei Wan, and it's a very interesting theory that I picked up from Dr. Li. She is a Chinese she was trained in Chinese medicine, and she is also a Western allergist. So if you can see here, she works worked at the Division of Allergy and Immunology in the departments of Pediatrics in Mount Sinai School of Medicine. And you can read the article right here about her combination, or why she chose Wumei Wan for the Chinese herbal therapy to do this study, where she showed that taking this formula was able to kind of reduce the symptoms of food allergies significantly. So you can read this article. In here, I wrote the formula, the original formula. This formula was changed a few times in the process of the preparation for the study. This is basically classical Xiao Chai Wumei Wan, sorry. And so later on, this was changed. So her article, in the next article, which you can read here, she eliminated the futsi, the zhifutsi, and the shishin from the formula because there was some issues, administrative issues, with getting it approved for the study with these two herbs. So in her study, those herbs were eliminated. When I prepared this formula, I kept them in. She also stresses, when if you read this article, the importance of the quality of linger, because apparently there are many varying qualities of linger, and the linger that you want to use in this formula is of a high quality. I want to now go back a little bit and come back to the basics a little bit, and talk a little bit about the allergic reaction in general. We can call it the atopic tendency of a patient. So I wanted to stress that an allergic reaction is something very unique, and it's a self-amplifying chain of reactions, meaning that it's almost like a snowball. As it rolls down, it becomes bigger, and it begins with a little trigger. It can be really small, and we know it, that allergies can be exposure to something that is microscopic, that you don't even see it. A very small particle of gluten can trigger a really strong reaction in a patient. So this trigger creates the series of effects, and the symptoms you experience and signs that doctor find on examination are all from that trigger. And the trigger can be, as I said, really small, but the effects can also be either very small, maybe a little reaction, to catastrophic, meaning that you can end up with anaphylaxis, which can mean that the patient could die from an anaphylactic reaction. So this is the most interesting thing, is the wide range of effects that can happen from a small trigger. From my perspective, from a Chinese medicine perspective, this should indicate that this is it's almost like it indicates the presence of heat, because the reaction can be blown up to really something quite enormous, more activity than you would get normally. So it's amazing to see that, to think about it, that your immune system is this kind of vast system of many components. It's almost like an orchestra, that each section of the orchestra needs to be synchronized with each other, and the output of every section should be right at the balanced way. So all this organization and synchronization, the director of the orchestra is this kind of white blood cells that we call lymphocytes, and they are the basis for the whole keeping this whole thing balanced. But I want you to remember that we actually have, although we say allergy is one big thing, but there are actually 4 different types of allergies. The first type, the most common, is IgE mediated. That's our regular allergy that we experience frequently. That it's when we have an allergen exposure, it attaches to the IgE antigen, and then it stimulates the mast cells. Mast cells is something you want to remember when you treat allergies, because I'm going to mention also in a little bit, there's a mast cell function syndrome. So we'll talk about that in a second. And the mast cell releases histamine, and that's why in Western medicine we give antihistamines to stop that histamine response. The histamine is a mediator, and it creates a lot of activity within the surrounding tissue. But there's also type 2 and 3 mediated. We group them together because usually the mediator of that group is the IgG antigen. And so the type 2 and 3 are the main cause for things like drug allergies or food allergies, which that's where we probably will need to look for the IgGs for food allergies. And especially somehow this kind of a excessive reaction of the IgG is, first of all, more slow, but we can see it affect various parts of our body, like migraine headache is could be a symptom of an allergic response or a type 2 or 3 allergic response. Abdominal pain, arthritis is one of the symptoms. And it also is the difficult thing with IgG mediated or the type 2 and 3 allergies is that they're slow acting, meaning that IgE is usually quick. So you get the exposure, the effect is quite quick within, anywhere from minutes to hours. But with IgG, the effect is long. So it can take 24 hours from exposure to symptoms, or 72 hours sometimes in some cases. So that's one issue with diagnosing this type of allergic response. And also, traditionally, IgE testing is the gold. It's how traditional allergists test for allergy. It's only IgE. Traditionally, they don't test for IgG. It's not mainstream, at least in the US. You have to go to private laboratories to get IgG testing. And, the lab I work, it's a private lab I work with, does IgG and IgA, another antigen that they test in comparison to IgE. So you can get all the range of different antigens and see what types of allergic responses could be going on. Type 4 actually does not require antibodies. The allergens, or the thing that's activating the allergic response, is it triggers an immune cell called a lymphocyte directly, so it doesn't go through the antibodies. So example for these are things like nettles, or contact dermatitis, or poison ivy. And a lot of times asthma is a response of this type of allergy. In fact, 50% of asthmatic reactions occur because of type 4 reactions, and not the other ones. So when I look at these atopic disorders, there's a few things I make sure to especially when I'm making the diagnosis. It's something I take time to ask. It's usually I spend time, especially on my first evaluation, to ask about prenatal influences, about the breastfeeding process, and then about introduction to new foods. This comes because we'll see a little later that, oh my God, I'm running out of time, that there are different types of Western theories that I'm going to go over really quickly, just to mention, that talk about these prenatal influences, breastfeeding, and introduction to new foods. So there are lots of studies that show that influences of the mother's diet during pregnancy and the mother's emotional state and her balance of qi are contributors to the developing child, and that we as Chinese practitioners actually have tools for what we call fetal education. So I think, I actually a lot of times start to treat the baby in vitro, meaning while pregnancy. I talk to mothers who come to me during pregnancy, and we discuss what we need to do every month, what organ is growing, and what we need to strengthen to create influences. So on the other side of that is that what the mother is doing, what's her emotional state, will influence the developing baby. And one of the things that it comes to play is that we have kind of recent studies that examine the role of essential fatty acids, meaning omega-3s, in reducing allergic disease. So when the mother is exposed or taking or eating a diet rich in EFAs, would that reduce the allergic disease? And there is evidence that good prenatal prevention of atopic disorders in mothers that ingested higher amounts of omega-3, the polyunsaturated fatty acids. And also children who have a richer diet in omega-3s, meaning through breast milk, also have less of a risk of getting atopic disease. Of course, breastfeeding is extremely important to the development of allergic diseases. So there's a lot of studies that show that exclusive breastfeeding, 4 to 6 months, have been associated with lower risk of developing atopic dermatitis, food allergy, et cetera, allergic rhinitis, and asthma. The biggest issue I have that, and we're going to talk a lot about introduction of food and breastfeeding as opposed to formula food in the course, but formula can cause a lot of issues. I think one of the biggest, just off the top, is that the richness of the formula, because there's so much fear that there's not enough nutrients, creates it a very rich and difficult to digest food for the baby, and creates more like a lot of phlegm production. So if you want to hear more about that, you can definitely join our course. Early solid feeding, also really critical. Again, you'll have this slide so you can read about it, but I really insist that there's no feeding, doesn't start before 6 months. And I also look at how it's introduced. I have there's the rule of the 3 readies. So the baby has to show readiness in 3 aspects. Altogether, all 3 have to be present in order to present solid food. One is being able to sit and not flop to the side, and be able to hold yourself straight. The baby has to be able to hold himself straight. That's number 1. Number 2, there needs to be at least 1 tooth out. And number 3, then he needs to show interest in food. So these are the 3 things that need to converge. If you introduce foods before that, there's a possibility of it causing a pathology, and one of the pathology is, of course, allergic reactions. I always keep in mind that when I see allergies, I always need to look at diet. So allergies equals diet. For me, it's really an important thing. I ask a lot about what are they feeding, how are they eating it, what is the schedule, and so on and so forth, to see if I can see the correlation. And I usually send patients with a 3-week food journal. So for 21 days, they need to keep a journal, and here's are the things that I ask about. I quickly want to breeze through a few of the theories of allergies. and I'll send you so you can read it by yourself. But one of the theories I wanted to discuss is hygiene hypothesis, and the reason I wanted to bring in is I think that one of the reasons that Dr. Lee ended up thinking about using Wu-Mei-Wan for allergies, because it definitely doesn't, you wonder why she came up with this idea, I think came from this hygiene hypothesis. So the hygiene hypothesis noticed that allergies are less common in the developing world, where there's situations of less intense sanitation. Sanitation is not as good. Children suffer a lot from parasites. It's almost a regular thing. I work with children in Guatemala. I go there. It's like parasites. It's you see it all. Every other kid has parasites. It's not abnormal. And this kind of parasitic infestations causes the reduction, or it occupies the eosinophils, which are a really important cell that from our blood cell that is important in our allergic responses. And maybe that's why we don't see as much allergies in these places. Also, that children living in large families, growing up with pets, less likely to have allergies. So you can look at that. And I think that's the theory that created the thought process of using anti-parasitic herbs for anti-allergies. So you can briefly look at these things. So the other theory I want to just mention, eating organic foods, because pesticides and GMO can be irritating to the gut and cause a cascade of symptoms that can cause allergies. There's a strong link between vaccination and allergies. We'll see that in a second. Why? The GAR, this is a formula I developed, and you have a link at the end of this this presentation to the website of my Herbal company. This is a formula I developed to support the process of vaccination with herbal remedies, and you can read about that too. Leaky gut syndrome is also associated with allergies. If you are not familiar with that, allergies is definitely the gut from some kind of an inflammatory process becomes more leaky. Things are entering into the bloodstream. It creates a strong reactivity, and allergies are part of it. So if I suspect that there's a leaky gut syndrome, and by the way, these laboratories can check for markers of leaky gut syndrome, either with a stool test or with a blood test. This is the mast cell activation syndrome. Again, very, very important theory in treatment of allergies. You can read this publication about the activation. What is the diagnosis criteria? How do we know that there is a mast cell activation disorder? There's two types of them. One is called mastocytosis, which is not something I usually treat. This is actually an excess presence of mast cell in the body, but we can definitely treat mast cell activation syndrome, and you can see the different symptoms. It's a very wide range of symptoms, from dermatographism, meaning when you scratch your body, it leaves lines, to cardiovascular symptoms, to brain fog, neurological symptoms. And so a very, very wide range of symptoms. But we can definitely help with both herbs and acupuncture. I want to show you that there's environmental triggers. Aluminum is one, and that's the link between aluminum and allergies, right? Aluminum is present in immunizations. So that's the link. There was a research study that was done to a combination of three formulas, Shuang Huang Lian, that stimulates mast cells. So this is the combination to use for reducing mast cell activation syndrome. These are the herbs: Lonicera, Scutellaria, and Forsythia. The points I use are this kind of area between around large intestine 10. This comes from both Kiko Matsumoto and various Japanese technique talk about this area as being a very strong immune regulating place. Triple warm assist, 16 being a lymph node regulator, do 12, especially in kidney, is really important for lung Qi regulation, and it's called the thymus gland reflex. In children, it's really important for regulating the immune system. Behind stomach 44, we talked about, and one of the things I've started doing after I actually took an introductory course to NAET, which I don't use in the end, but I took the idea of working on the spine. NAET was developed by a chiropractor from California, for eliminating allergies technique, that she uses acupuncture theory and chiropractic theory, but she talks about the importance of working on the spine for reducing allergies. I palpate and see if there's any tight spots around do 2, do 3, and do 6 in particular, but all over the spine. And there's this formula REACT that I mentioned, which is based on Wu-Mei-Wan for the treatment of allergies. And you'll have, again, the slide at the end will show you the link to the website to read about it, and you can read. The reason I'm rushing is that I want to leave a few minutes for questions, and we are probably at that point where we can open it up for questions. Wow, that was a race. So this is the website for the Motion Herbs, and this is also other than the course I'm doing with Global Branches, I'm also teaching a year-long course with pediatrician Stephen Cowan on treating children, Jingshang Pediatrics, and back there's also if you're supporting kids for immunizations, you can find a lot of information on this website. So let's open it up and slideshow for questions.
If there are any questions, please don't hold out. Exactly.
Stop share. Okay. So if there aren't any, then we can definitely end, or have people feel free to reach out and questions later. I know I rushed through a lot of information, and I hope it was helpful.
Yes, that was extremely interesting. Thank you so much for sharing. We're still going to give 1 or 2 minutes for anyone who has any questions or want to share any experience. Don't forget that this was just a very small preview of what we'll be able to learn with Dr. Heller in our course that will start quite soon. Make sure to check our website. Exactly. Thank you, Moshe.
Yeah, that's my email. If somebody wants to contact me, and I will send. I'm not. Shall I send? Oh, to the PowerPoint in PDF to the info at.
Yes, please
Okay.
send to our email info@globalbranches.com, and then we will send to all the participants, those who were here today and even those who weren't, the
Okay.
recordings through a YouTube link and the PowerPoint provided by you. Thank you.
Great. Thank you. I hope you will all learn something, and we should have a mission of healing this world from allergies. It's an important one.
Exactly.
Okay.
Thank you so much again. Don't forget, early bird price to this course with Eller ends next Sunday. You still have a week, and the course will start on March 13. Thank you so much for your availability, Heller. Thank you very much. Thank you, everyone who attended, and we hope to see you soon.
Okay.